Well, it's Thursday today, and we're joined by our In Focus Health correspondent, Linord, Moudou. And you have some news about malaria?
Yes, indeed. Aid groups and the government of Southern Sudan are set to distribute 3 million bed nets to fight the spread of malaria. Cathy Martinier has more on the story.
18 out of 44 babies in Juba Teaching Hospital's children's ward in the southern Sudanese capital are sick with malaria on this early April afternoon. 9-month-old Joshua has been here for a week. His mother, Betty Pita, says Joshua was in bad shape when he arrived.
Through the vomitings and then the diarrhea. That is why I came to know that he's affected with the malaria.
Malaria is the #1 killer of children in southern Sudan. Pregnant women are also vulnerable to contracting and dying of malaria. There are no reliable statistics on the number of people in southern Sudan who suffer or die from malaria. Southern Sudan had been at war with northern Sudan for more than 2 decades. Under the terms of a 2005 peace accord, southern Sudan was granted semi-autonomous status for a 6-year period until a more permanent solution can be worked out. The post-war administration is grappling with how to develop quality health care services in a vast, resource-poor area that is only now beginning to be developed. It is a problem that Acting County Medical Officer Dr. Paulino Petilla faces at Terekeka Health Center, about an hour's drive from Juba.
Particularly patients brought from rural area there, they spend more than 2 days suffering with the malaria. Automatically, when it reaches here in that serious, sometimes we lose that patient. That is common.
Dr. Petilla says that he sometimes has to send patients to the market to buy malaria drugs because roads are impassable during the rainy season, and hence drugs and other vital supplies do not reach the clinic. He says that patients have to walk up to 16 kilometers to get medical attention. Malaria is a parasite that is transmitted to humans from the bite of an infected mosquito. Mosquitoes breed in stagnant water and bite most commonly during Sudan's rainy season, which runs from April to November. The use of bed nets has been proven to cut down malaria transmission by as much as 50% and reduce the number of children dying from malaria by 20%. To that end, the health aid group PSI and the government of southern Sudan last year distributed 1 million bed nets. Marcie Cook is country representative of PSI.
The anecdotal evidence that we have indicates that there are less people presenting at health facilities with fever and suspected malaria.
Amalia Paulino used her bed nets to protect 2 of her 4 children from contracting malaria. She says the results were dramatic.
The small children who are currently using mosquito nets are not being exposed to malaria, which means they will not get sick from malaria. Those other small children do not have nets. When I compare the cases, those children get malaria, and the ones who sleep under the net do not.
With support from the Global Fund to Fight AIDS, TB, and Malaria, PSI and the government of southern Sudan plan to distribute 3 million additional nets by the end of this year. Health activists say continual support from the Global Fund and donors is needed to diagnose, treat, and prevent further deaths from malaria. Cathy Martinier for VOA News, Juba.
And medicines of all types, like the anti-malarial drugs mentioned in our report, are often sold on the streets and markets of Africa. But so too are fake and counterfeit drugs. Africa's illicit drug trade has burdened the continent's pharmaceutical industry for years. And what to do about it topped the agenda at the 10th International Pharmaceutical Forum held recently in Abidjan. Dr. Boniface Okuya from the Republic of Congo is president of the Interunion of African Pharmacists.
The profession of pharmacy in Africa is at a crossing point because of the increase in its flaws, which include the illegal practice of pharmacy, counterfeit, and illicit drug activities in public health facilities, markets, and streets.
Dr. Parfait Kwasi, president of the Order of the Ivorian Pharmacists, agrees.
This issue is at the forefront of the agenda because of the devastation these drugs cause to public health.
Medical experts say most fake drugs do not contain the active ingredients that patients need. Others contain incorrect dosages or have hazardous ingredients. Even legitimate drugs can be ineffective if not properly stored or are past their expiration date. Again, Dr. Okuya.
This is why during the course of next year, the Inter-Union of African Pharmacists will take on strong measures so that the streets, markets, the police and the government can hear us. Not only have we to make the government treat those who sell illicit drugs as criminals just like pirates or cyber criminals in other countries, but also combat them until they run out of strength.
People in developing countries are particularly vulnerable to the sale of illegal drugs. Because legitimate drugs can be expensive, poor consumers fuel demand by knowingly or unwittingly turning to cheaper or counterfeit versions. In a report released earlier this year, the International Policy Network details the burden that fake drugs have on less developed countries. The report says that fake tuberculosis and malaria drugs alone kill an estimated 700,000 people a year. The Order of Ivorian Pharmacists wants government to be more aggressive.
We as professionals urge the government to use law enforcement and all resources available to crack down on illicit drugs because it is their responsibility.
Dr. Rémi Alakwadjo is Côte d'Ivoire's health minister. He says his government has taken steps to better regulate the country's pharmaceutical industry.
We have put together a strategic plan that includes, among other things, the creation of the National Committee for Pharmacovigilance and the use of law enforcement to combat illicit drugs.
Such a plan is what participants at the Pharmaceutical Forum say they want for all of Africa and to bridge the gap between the continent and the rest of the world in the practice of pharmacy. An exhibition took place along with the forum displaying various aspects of the pharmaceutical industry. Take a look. More than 3,000 people visited the exhibition at the forum in Abidjan. Such well-known pharmaceutical companies as Sanofi Aventis, Pfizer, and Johnson & Johnson showcased products and services during the 4-day event. So did the smaller Sudan laboratories from Morocco, which supplies treatments for diabetes and other diseases to more than 40 countries in Europe and Africa. Célestin Kofi is Sotema's representative in Côte d'Ivoire.
Le tout premier produit pour lequel on est connu, c'est les insulines. Pour le traitement des diabétiques par insulinothérapie.
The first product for which we're known for is insulin. We have some very good quality insulin. We have anti-blood pressure treatment, as well as pain medication and many other products.
Zakaria Mahmoud represents Gen Pharma, another Moroccan laboratory.
Our goal is to deliver generic drugs to the population at a price that they can afford.
Gen Pharma produces Genflu, a generic version of oseltamivir, a drug used in the treatment of the H5N1 avian influenza virus and the more recent H1N1 swine flu virus.
It all started during the outbreak of bird flu. Roche laboratories could not produce enough supply of oseltamivir for the world, so they gave us a license to produce the generic version of the drug.
The exhibition also showcased other pharmaceuticals, including over-the-counter and personal hygiene products, cosmetics, and some tools for weight loss. And that was my trip in Abidjan.
Great report. Thank you so much.
Thank you.
That's Linord Moudou, who joins us every Tuesday and Thursday. We'll be right back with Vincent Makore.